Right, we're recording. So I'm joined by Dr. Bodner from Heart Fertility in South Africa. Hello, Dr. Bodner.
Hello, Sarah. How are you doing?
Yeah, good, good. Thank you so much for talking to me today. So I know you've been in clinic. Well, you are in clinic right now, aren't you?
Yeah, but about to finish.
Oh, amazing. What time is it with you then?
So it's 1:15, but today, because of my birthday, we're not working for so long.
It's your birthday.
Yay!
Oh my God.
Actually, we do, we do anniversaries rather.
Oh, okay, okay. Well, happy anniversary.
Happy anniversary of the 29th birthday, right?
Absolutely, yeah. Well, I love you even more then for taking time out today to talk to us. And because I wanted to ask you some questions today about egg donation and the process of egg donation. So I tell you what, can you start by just explaining to me what egg donation means?
The egg donation in the humanitarian sense means that we have a lady who is donating her eggs from the ovary to another lady who, for various reasons, can't use her eggs in reproductive cycle.
Okay. And what sort of, and why would a woman not be able to use her own eggs?
Majority of cases here, it obviously may vary from country to country, is that we have patients who, when they go for IVF, are often of a very advanced age. So we're talking 40 and above. So that their own egg quality is not good. And if you were to stimulate those ovaries in a cycle, you would not retrieve enough eggs or any eggs that could be fertilized and then be used in the IVF procedure.
If a woman is in her mid-40s coming to you, is it very rare that she could use her own eggs? I mean, should you assume? I mean, you should never assume, but if a woman is in her mid-40s, is the chances of her using her own eggs really
very, 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 very poor?
Oh, life is so cruel.
There is a beautiful statistic that I have in one of the fertility books. I don't know if you want me to show it to you, but it gives you an indication of 40 and then goes down, positive pregnancy rate, clinical pregnancy rate, and then live birth rate. So when you go to 45 and plus, you can literally expect no live birth rate. Of course, we have those, in between, there will be somebody who has a pregnancy and it goes, but it's really one out of how many?
Life is just very cruel, isn't it?
Yeah, it's very cruel because the males can reproduce and until they die, basically, and you can't.
Where is the logic?
Well, remember that even the Bible was written by males, so I think it is coming from sorry, I'm just closing a door. It's coming from a very patriarchal society. Even the men up there.
Yeah, well, I've had a lot of messages though from women who have been told that egg donation is the only route for them if they want to become a mother. And yet, even though they have accepted that is their route, their male partners haven't.
Struggle to do with it, yeah.
Like really, 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 really struggling. And I mean, you must have patients who are the same. Do you offer them counseling? How do you get around that?
So we get patients where we have the when you tell them about egg donation, it often goes on both sides, the male and the female, who are kind of objecting to the issue of egg donation, the first thing that always comes up to say is that then this is genetically not my child. And then we have gone into the issue of saying, okay, but remember, if we talk about epigenetics today, we're not all just the genes, we are our environment, we are the womb environment. So it's not just that. And one of the things that I always tend to talk about is twins, okay? Twins that get separated at birth, and monozygotic twins that get separated at birth and raised in different families. And if you were to look at them genetically exactly the same, but look at how they differ depending on their life circumstances. With some of them, you have to suggest, or we would always say, go for counseling. Okay, so we would make them see a psychologist, you know. We often also struggle with the fact here, I don't know about overseas, with the issue of the cultural acceptance. Okay. So I've had this discussion recently with somebody where I said, you happily adopt your sister's child if she's not well, but you wouldn't adopt another child. And if I talk to you about egg donation, then it's like, whoa, no, you know. So there is often this issue about bloodline. And the other thing is literally a cultural one where there is a lot of, the repercussions in the community. If somebody knows that you have had egg donations, they often use that in a very, in a very bad way. The patients get ostracized, not really ostracized, but they will hear about it, that somebody knows about it, you know? It's almost like a tool to tell you, I know about what you did, etc., etc.
Are attitudes getting any better?
I think they do, but they do in the more educated scenario. So the more education there is behind, the better the attitude.
Yes.
But because education is a major, major, major thing.
Yes. Yeah, absolutely. Which is why we're trying to do as much as we can, you know, in Africa as well, you know, with IVF Babble Africa, just getting as many real stories as well. We're trying to encourage, you know, men and women who have had their families through egg donation to talk about how utterly incredible it was to go through that process and to allow their families.
I've actually often asked patients that, will you tell your child in future that, whatever, sperm donor, egg donor, majority of our clients are no.
Right.
Yeah. So there's it's no, I will never tell, you know. And we know from research that if you tell somebody that, I think the best age group is about the age of 3 or 4.
Yes. Okay. Yeah. My daughters are IVF. I know it's different because it was my eggs, but I told them very early, and they just shrug it off, right? That's life, you know. And so, but do you see, even though you say attitudes aren't really changing, is there an increase though in the amount of people having egg donation, would you say?
Yeah, definitely.
Which is really because then you think, if that number is increasing and more people are having egg donation, if only the attitudes could change as the numbers are going up, and then it would just be okay, you know. And not such a taboo subject.
Yeah, interesting is though that we seem to have accepted that sperm donation is okay, isn't it?
Yes.
But with egg donation, I think it's still,
I mean, how is that? I don't even understand how attitudes can vary so dramatically. But listen, I wanted to, can you talk to me about the process? What happens then if egg donation is the path you're going to go down? What do you do?
So if egg donation is the route that the patients want to go, then there is two options. You have the egg donation where we refer them to a donor agency. So the donor agency has screened their donors according to genetic disorders, current blood tests for infections, psychological status, and they have been screened, and those girls want to donate eggs. So what happens is the patient gets in touch with a donation place, and they will have a look at a catalog of pictures. Those are not current pictures, those are usually childhood pictures, and they will look, and according to other variables, etc., they will then choose their donor. That donor will then come to us for assessment, and then she will be enrolled in the IVF procedure. The donor and the recipient have no contact with each other, so it is anonymous. We will retrieve the eggs. The eggs will be fertilized with the husband's sperm. And then when we have the embryo will be transferred into the recipient when it is deemed day 3 or day 5. If patients choose to bring a relative, which is possible, that relative should obviously be in a good age. She should have what we call a good ovarian reserve. That she can then be acting as the egg donor, but there also needs to be a legal document between them to put the boundaries. Okay. Yeah, so both of it is possible.
Yes. So in my head, I always thought that the eggs were frozen. I didn't realize. Well, I thought the donor's eggs were frozen. So
you can have that. You can have the donor bank where you say, okay, we have frozen eggs in the bank. So it is either then that the person will choose that there are already eggs available and use those and buy a certain amount of eggs, or it will be such that we do fresh cycles. Okay.
And so when you're
I think it depends on the logistics of the clinics as well.
Yeah. So when you're choosing your egg donor, you've got a photograph of the mother,
baby,
the woman as a child, and are there like characteristics? Do you look at like things like that as well?
Well, I suppose that we, when those patients look at those pictures, that they will look and say, oh, could be looking a bit like so and so in the family, and therefore let's choose this one versus that one.
Yes.
Yeah.
Oh my gosh, amazing. So what sort of age then are these egg donors? Are they must be
in their 20s.
Wow.
Yeah, they're in their 20s. Yeah. Yet with patients who bring their own egg donors, we often find then the girls being in their 30s. We also have a limit as to when we want to stimulate them. But usually egg donors, you find they're in their 20s because they're obviously the most likely to have a lot of eggs to be aspirated. You know.
I got an email from a very young woman recently who was just terribly, terribly upset because her AMH was so very, very low. And she emailed me and she just said, why, as a young woman, has this happened to me? I mean, I'm not a medical expert, so obviously I couldn't advise her. So I put her in touch with another doctor. But why does it happen? Like, why?
Well, interesting enough, when we were talking about this, I have a patient that sat in front of me before we had having our meeting, our conversation, who's got a history of absent uterus, blind ending vagina. She does have ovaries. She's got typical sexual characteristics. So she needs to go through surrogacy. And she does have ovaries, but until we do the test, we actually do not know how good those ovaries are. So it could be an inborn issue. You have had patients who've had previous surgery. How many people have had an ovary removed or half of an ovary removed because of cysts, etc., etc.? And there, I think it depends a lot on what the surgeon does. I remember one of our old endometriosis surgeons, very good, but if he had a lady there, he would always remove one ovary. And you say, but why are you removing the ovary? Yeah, she's got another one left. Yeah, but okay. So it depends on that. Endometriosis, inborn. Yeah, and I think then it's just maybe also our genetics, you know. Patients with families with early menopause, I would assume, you know.
Oh gosh, yes, of course, yeah. Early menopause, which is another topic that we've had a lot of messages on recently.
Yeah.
But just knowing that egg donation is there as a path to parenthood,
absolutely,
is an incredible thing.
Yeah, I mean, in my home country, egg donation is not allowed.
Is not allowed.
As far as I'm concerned, you can't have egg donation.
And where is that? Where are you not? Where is
Germany?
That? Wow.
I've just recently spoken to one of the lady in Germany who they're running these clinics, and so they're doing IVFs, right? So it's a big company that runs IVFs, and she was telling me that egg donation at this point in time is not allowed. Okay, you know that pre-implantation diagnosis is not allowed, but anyway, so it's country specific, obviously.
I did not know that at all.
So it depends on the country, you know, and the laws. Yeah.
Do you get people, obviously the last couple of years has been crazy with COVID, but have you had people traveling from abroad to you to have egg donation?
Well, we do have patients that, so here we have patients who come from other African countries, and then we have patients who choose their egg donors here, and their donor actually flies to Mexico, India, America, whatever. Yeah.
Oh my goodness me.
Yeah.
What about do you ever get anyone from the UK?
We've had patients who come here. Yeah. So, but then I would think it's more patients who happen to live here at this point in time, and then they're doing it then. Sometimes also often a cost factor. I'm not entirely sure how the remuneration of medical aids is in the UK towards IVF. Here, we have 2 medical aids that pay a portion of IVF. The rest is paid cash by the patient, which makes it so more expensive.
So what should somebody do then if they are, wanting to start the process? What's the first thing they do?
You mean egg donation or IVF?
Yeah, egg donation.
Well, usually the patient is in contact with a fertility clinic and has been assessed, has been prepared, etc., etc., and then they will get in contact with respective egg donations that the fertility clinic tends to work with, you know. Or they have Googled, of course, and they go to a donation agency of their choice.
Yes.
You know.
But if someone was coming to you, you'd be able to deal with it all there with you, as opposed to the patient having to go off and having to find a donor.
No. We can refer them to respective places.
Yeah. Okay. And then counselling. You could advise them about who to speak to. Yeah. Okay.
All of that.
This is all absolutely brilliant. And just in terms of just going back to what you were saying about, you know, attitudes and trying to change the way people view egg donation, because it is terribly sad to hear that there are negative thoughts and attitudes towards, you know, families who have had, you know, children through donation. What can we be doing to help? What can IVF Babble do? What can we do?
I think again, education, information, very, very, very important. I would then also just say a bit difficult is, again, which population group you're talking about.
Yeah.
If you're talking about deep trodden, well, how shall I say, simple people who've lived in their little bubble, who lived in their bubble all their life, who haven't gone out of their village, city all their life, who have a very narrow-minded assessment, who are worried about what the neighbor would think. That's the whole process. I don't know how much you can do about that, because that is more an education principle on a more, I would say, in a bit more global scenario.
Yeah.
Global awareness, and that again could start in school. I don't know if you can convince middle-aged people to now suddenly change their opinion about that.
Yeah. Yeah, we went to we went to a fertility show in Africa two years ago now, I can't remember, and it was really, really fascinating talking to some of the men and women there who were struggling to conceive, and they were really open with us and were telling us that actually infertility can be seen as a curse.
It is actually so bad that somebody who, I'm sorry to say this now, should not have children because they are not in a position to raise them, they can't afford them, and they have one after the other. And then you have a couple that is well said, good environment, has the financial means to raise a child, and they can't. So you will find that those ones who have the children will point fingers at them openly, and it gets spread like a wildfire. When I ask patients and say, okay, with egg donation, do you have somebody that you would use if you talk about a genetic link out of your family that you would consider? How many have said to me straight away, no. Because we don't want to have the bad mouthing afterwards. You know?
Yeah, it's heartbreaking, and yeah, I think what we need to be doing is having more conversations with brilliant doctors like you, and just like you said, educating people. Infertility isn't a curse at all. It is something that millions and millions and millions of people across the world have. And there are things we can do.
It's also, like, I'm sorry to interrupt, it's also something that's not spoken about. You know, you do not tell your next that you're having a problem. And if you think about it, we have ladies, there's a lady that I delivered her twice. She's the tender age of 56 now, so the youngest is a few years old, never had a child. So people around her believe that those children came on her own account, okay? And then you have those ones who look at her who haven't had a child. They will then come to you and say, oh, but so-and-so is pregnant, do the same thing for me. And then you say, but it's a little bit different, you know?
Yes, yeah, absolutely. But like you say, that, you know, spoken about in whispers or not spoken about at all. Even in the UK, so my IVF babies are now 10. When I had IVF, no one was talking about it. No one was talking about it. I didn't know anyone that was having IVF. And then when my children were born, I said to my husband, please don't tell anyone they're IVF, because I was ashamed. And now 10 years down the line, people, especially, you know, in the UK, you know, in Spain, US, they are starting to talk. And, you know, and now, you know, I'm proud that I went through, through IVF.
These days you will have, I remember seeing a report about somewhere in America about egg freezing parties. So there are all these young women who go there and say, okay, we're going to go through an IVF cycle and we freeze our eggs because we don't want to get to the point where we will sit one day and say we have nothing.
Yeah.
And it's very popular, it seems, eh?
Yeah. Is it getting more popular in South Africa?
Yeah.
Yeah. That's good. That's really good that, you know, these numbers are increasing, because it does mean that people are starting to communicate and starting to talk and listen.
Yeah. Yeah, definitely have patients coming and saying, I think I need to freeze my eggs because I don't see anything happening in the near future. I will, though, always say to them, let's do your ovarian reserve measurements first to see if this is an urgency or if you can wait a little bit longer, you know.
Just out of interest, what is the latest you could possibly leave it, would you say? Or do you only base that after you've had the...
I base that after on the ovarian reserve, you know.
Yeah.
Because, I mean, after all, you literally just need one egg to fall pregnant. But then if you have a low ovarian reserve, then the question is, will that egg come along to be fertilized?
Yeah.
So rather than harvest them before they get to the point of being not in a good condition.
Yes.
Mm.
Well, look, I won't leave you. I'm not going to take up much more of your time because, as you said, today is a special day for you. But
it's okay. Having dinner tonight.
But it would be amazing to talk to you again about other things, because, like you said, we've just got to keep informing and educating and talking about it if we're going to change attitudes.
I mean, you mentioned the fertility show. We had one last year before COVID, I think in February.
Yeah, I think that's yeah.
Did you come to that one?
Yeah, I think so.
In Santon, Gallagher Estate.
Oh no, actually no, maybe not. I've lost track of time, if I'm honest.
So yeah, that was last year February, and I think it had a very good attendance, and yeah, I think it was really informative, you know. But as I said, like with so many things in life, you just need to put it out. You need to talk about it. You know, I mean, everybody listens to podcasts. Everybody listens to YouTube.
Yes.
Maybe that's another way of, you know, influencers.
Yes, absolutely.
Influencers. Let's find an influencer.
Yes, let's find some. Well, let's definitely do some more of these conversations. And like I said, we'll put this out, you know, we will put this on YouTube as well. And let's just keep talking. And yeah, thank you so much.
It's a pleasure. It was lovely talking to you.